too. So.
Okay.
All right, so this video is going to be about blood flow through the heart. Here we go. So blood is going to come from the body, deoxygenated, back into the heart through the inferior vena cava and the superior vena cava. Okay, the inferior vena cava is going to collect blood that is deoxygenated from the lower body, and the superior vena cava is going to drain blood from the upper body, and both of these vessels are going to drain into the right atrium. This blood is deoxygenated, and that's why I'm trying to show blue arrows. And the vessels are blue for veins because it's deoxygenated. Once the blood returns to the heart into the right atrium, then the right atrial walls contract, and it's going to push the blood through an open tricuspid valve into the right ventricle. Blood returns to the right atrium. When the right atrial walls contract, it's going to squeeze the blood through the tricuspid valve into the right ventricle. Then, when the right ventricular walls contract, it's going to push blood through an open pulmonary semilunar valve into the pulmonary trunk, and that blood's going to go out the right pulmonary artery and left pulmonary artery out to the lungs. Pausing for you to take notes.
Can you repeat that?
Of course I'm going to repeat it. I usually repeat it because that's usually helpful. All right, so after the blood comes into the heart, through the tricuspid valve to the right ventricle, then the right ventricular walls will contract. By this time, the tricuspid valve will be closed, right? Because after it opens to let blood through, it closes. So when the right ventricular walls contract, this valve is closed, and the blood has nowhere else to go except up the pulmonary semilunar valve into the pulmonary trunk, out the right and left pulmonary artery to the lungs. This is the only time that an artery carries blood that is deoxygenated. These are still considered arteries because of the direction of blood flow. So arteries carry blood away from the heart. These are carrying blood away from the heart. It just so happens that it hasn't yet picked up oxygen. It's the only time in the body when an artery going away from the heart carries blood that is deoxygenated. What we just talked about is called the pulmonary circuit, how the blood returns to the heart and then is pumped out to the lungs. The right side of the heart functions as the pulmonary circuit, or to the lungs. Makes sense? So once that blood goes to the lungs, it's going to pick up oxygen. So now when it returns, now the blood is oxygenated. I tried to use a pink arrow, but it really looks white. But the idea is when the blood returns from the lungs, it is oxygenated, and the blood returning from the lungs returns via the pulmonary veins into the left atrium. So now we're on the left side of the heart. Just like I said with pulmonary arteries, pulmonary veins are the only veins in the body that carry blood that is oxygenated. Usually veins carry blood that is deoxygenated. But these pulmonary veins, they're still veins because the blood is going towards the heart. But they're the only veins going towards the heart that carry blood that is oxygenated, simply because it's just come from the lungs. So, blood returns from the lungs oxygenated into the left atrium. Then the left atrial wall will contract to push blood through an open bicuspid or mitral valve into the left ventricle. Okay, so left atrial walls contract, pushes blood through the bicuspid or mitral valve into the left ventricle. And finally, when the left ventricular wall contracts, it's going to push blood through the aortic semilunar valve into the aorta and out to the body. You can't see in this drawing, you really can't see the aortic semilunar valve, but it would be tucked up underneath here. So the left ventricular wall contracts, pushing blood through the aortic semilunar valve into the aorta and out to the body. One more comment to make. We introduced it kind of coming into one side, then through the other, but in reality, both are happening at the same time, right? So both atria contract at the same time, and then and both ventricles contract at the same time. So they're kind of happening at the same time concurrently. But for ease of understanding, I think it's good to go through it one by one. All right, folks, there you go.